blood to brain. But probably most exciting has been many of the things we've learned about the NRF2 oxidative stress pathways, which are probably important in many diseases when you get to final common pathways of tissue injury. So learning about this drug and these studies, I think is going to teach us a lot about mitigating oxidative stress in many diseases and not just neurologic disease. So we're very interested in this drug. This will be oral, it will be twice a day, and one thing I must underscore is that both doses need to be taken. For a while, we thought we might have to take this drug 3 times a day, but twice daily dosing looks good. The reason why I bring it up, nice data, big data, it's very exciting, but here's what I wanted to show you, and that is we're going to have a certain percentage of people who have asthma. They're going to have abdominal discomfort. They're going to have loose stools. By the way, Charlie, some of our patients are going to love having loose stools because they haven't had loose stools, well, since the last time we had sushi together. So for them, it may be good, but there's going to be headache. There's going to be flushing, a little bit like the niacinamide reaction, right? Niacin. So there are going to be, I'm going to estimate, probably in my practice, maybe 10 or 15% of patients who are either not going to tolerate it or they're not going to take the second dose, which means we have to talk with them in the clinic and say, are you really taking both doses? Just because this is not a shot doesn't mean patients will not be adherent. By the way, Erica, I want to come back to you. I see Stan getting up. I hope that you never stop asking your cell set patients. Talk about negative trials. Could it be, wait a minute, could it be, this is my, well, you have to get me from both sides because I squirt. I squirt. And we go this way and that way. But this is the last point. How many patients do you know over the years that have taken CellCept and by some magic they became a little bit loosey-goosey about not taking it on an empty stomach? If you're a transplant recipient, they have it framed on their wall at their house an hour before or 2 hours after a meal. I cannot tell you how many people have gone into organ transplant rejection or have failed with myasthenia or MS, and my fellow asks, you're taking this CellCept twice a day? Absolutely, I've never missed a dose. But are you still taking it an hour before or 2 hours after? And now the observers from home are there, and they're looking at mom and saying, you don't do that. You take it during the meal. Oops, oops. And I would say with this drug, I'm excited about it, but one of the issues is going to be for those people who flush, have headache, abdominal, they want to take it. They're going to take it once a day, and they're going to break through. And you know what we're going to say about this in our practice? Oh, it wasn't as hot as we thought it was in the trials. That may be true in individuals, but there's going to be a confounder. You must ask them, are you taking both doses? And if not, why? Adherence is important. Okay, you wanted to take me off the stage because something special is about to happen. I'm about to end. You guys may not know this. This is the first year it's ever been done at the TNS. You promised not to say anything until I said it. Because I've always been guilty of doing this, Stan convinced me to have a circuit coupled to my pants, or my underpants, and when we go beyond 415, it can't happen until then. There's an electric charge that closes the circuit, and then I'm really off. But look, I have 15 minutes. Okay, I'm leaving, but I'm going to tell you something. When we started, I had an hour. Oh, no, look, it's in there. Okay, I love you, Stan. Thank you.